wanted to reflect on what are the real possibilities, the current possibilities of genomics, medical information, in the treatment of patients, in the understanding of diseases. And also to propose the challenge, what is going to happen next, what are the big challenges of the future, very much related with the access to the data, the artificial intelligence that is now getting everywhere, and the capacity of computation of all this data and methods. Well, we are facing challenges in the pandemic, during the pandemic, after the pandemic. Obviously, we want to be able to do a better response. The pandemic has been a good example, being better prepared next time, having more fast access to the data, richer sources of data, and being able to combine this data with better models in a way that we can prevent some of the things that has already happened in a better future. I think that the pandemic has many negative things, obviously, but some positive things, a few positive things, a better awareness of the need of being able to access the data, the big need of speeding up. We cannot be waiting for things to happen. We really need to make things happening. And this has led to some more opening of the health systems to provide access to the data for research, to facilitate the access for the research, and also a big push for collaboration between scientists, industry, the health system, the governments, to provide solutions. I think the collaborative spirit has something that has been very positive during the pandemic, hopefully will be maintained after the pandemic. That has been fantastic during the pandemic. You see, all the papers were in open, all the collaboration were open. We're collaborating with people all around the world in models for predicting, looking for drugs, looking for vaccines, treatments, sharing information about all kinds of things. I think many of these things will stay, and we'll learn a lot about the benefit of collaborating in these fundamental problems of health for humans. I think we are, if not the tipping point, I think we are very close to a tipping point. I think that essentially the new technologies around machine learning, artificial intelligence, they have a very deep impact in this area. We have seen only the beginning of this. Analyzing images has become obvious and it's like easy now. Analyzing text, natural language processing, for the first time we really have very powerful tools for analyzing text, biomedical text. We see the DeepMind type of predictive models, drug development, proteins. So all these are disruptions, complete disruption of what we were doing, what put us in a very good situation to see that we are in a tipping point in the way we analyze data, biomedical data. I think that this is a very positive development, that this becomes a real focus. There is a problem. We have to be able to do development, machine learning, artificial intelligence, data in an ethical way, in a way that is acceptable for society for good reasons, and it's not just fulfilling a tick. We do something, it's really believing in that and doing that. And there are very interesting technical developments that now we know are important because they are the solution to many of these problems. We cannot say that we have technical solutions for everything, but now that we know that the ethical issues are a real problem, we can focus in developing technology to address the problems of privacy, access, explainability, engagement of the patients, engaging the science and the public in general. In the developments has become really now possible technically, and we can really work in something once that we know is a real problem. Well, first of all, it's amazing the number of companies, big and small companies, that are developing incredible products that are, each one of them, many of them, are a revolution in a small area. We are very happy to have this back in Barcelona with full of people. That's great. And it's fantastic to see all these companies, big and small, developing incredible products, ingenious products, fantastic products with solutions. For me, what this is calling is for how we are going to evaluate these products to really make them applicable in the health system. How can we help from the Barcelona Supercomputing Center, from a public institution, to validate this product, to certificate this product, to make us sure that these are working. We're talking about digital products mainly, that they are working as expected in a way that the public system can really be secure about buying them. Well, obviously the benefit is seeing what is around, getting new ideas. I already met a number of people that are doing things that are similar, complementary, or different, and we can discuss. So I think that this, as an encountering point, is fantastic. And it's fantastic to see people in 3 dimensions too.